Hey, and thanks for joining. Typically, we're showing things like complex anterior segment surgery, artificial irises, lens exchanges, and iris repairs. But for this video, I wanted to show something different. The technique isn't difficult, but getting the technique done is. And that's simply a YAG capsulotomy. Where I am in Philadelphia, we see an awful lot of patients from the oncology service. These may be young kids with retinoblastoma or somebody with a melanoma. We have to do the cataract surgery, but we can't open the posterior capsule at the time of surgery. So many times these kids have to come back to the operating room to have their YAG capsulotomy. I've even had people come from other countries just to have a YAG capsulotomy, thinking that we have some fancy YAG laser that we can hang from the ceiling and do the capsulotomy. So for this video, I'm going to show how to do a YAG capsulotomy in the operating room. So the first step in doing a YAG capsulotomy in the operating room is disassembling the laser. So here we are getting ready to take apart our YAG laser. There's a few things that are important. One of the little handles that people or patients will hold on to will actually unscrew. Those little handles are actually acting like pinch bolts to keep the forehead rest on. So once we loosen those, we can simply remove the forehead rest as we won't be needing it. Now to get the laser to fit underneath the OR table, we have to take the little arms off. And there are two little clips, one on each side. Once you release that clip, you can carefully slide the arms off of the laser table. Now, everybody has a different table. I'm not sure if this is how yours will work, but we want that table to be as narrow as possible so there's nothing to hit. So here we are taking the other side of the table off, take the little clip apart, and then slide the arm off of the laser. Once the forehead rest and the two arms are off, we're pretty much ready to go. All that's left is to get that laser into the operating room. One important step here is make sure the laser is locked, otherwise it'll slide around the tracks, and more than once I've almost dumped the laser on the floor. Another important thing is using a backer board. This is the same thing that we would use for CPR in the operating room, but we're going to put it underneath the OR table, and that way we don't have a thick OR table, we have a very thin OR table. And the thinner the better, because we have to fit that YAG laser underneath the operating table. So this is what I was talking about. This is a pediatric backer board, and we're going to carefully slide it underneath the cushion of the OR table. The thinner the table, the better, because we're going to want to be able to position the laser underneath that table. And sometimes the cushion and even the thickness of the bed will get in the way, and we're not able to properly position the laser. We'll then pull the patient all the way up onto the backer board, and you can see how we have it fixed there with tape. Now we'll have to either move the patient up or the laser down in order to slide the laser underneath the patient. We need to get the bed higher than that. There we go. Make sure that when the patient is rotated, the eye having the capsulotomy rotates down to the floor. So if a patient's having their left eye done for surgery, you want to rotate that patient so the left eye is down. This allows the laser to be lowered, allowing it to fit underneath the table. So here we are back in the OR, and we're going to rotate that patient so that the left eye is down. And you'll notice we've got 3 or 4 people around that patient to make sure nobody falls off the bed. That's our fellow there helping me perform the laser as I hold the head still in the correct position, and notice how that laser easily fits underneath the table, allowing excellent positioning. Now what isn't excellent is surgeon positioning. It can be quite a challenge. We'll often have to kneel on the floor to get these lasers done. Now once the laser is complete, we can slide the laser out from underneath the OR table. Carefully the patient is rotated back so they can be extubated, and the backer board is removed. We'll then bring the bed in, transfer the patient, and we're off to the recovery room. So as you can see, doing a YAG capsulotomy doesn't require fancy equipment. It just takes using standard equipment, but used in a different way. So the next time you see a challenging patient who needs a YAG laser done in the operating room, maybe you don't have to send that patient across the country or across the world to have that YAG laser. Just see if you can creatively use your own equipment in the operating room. Thanks for watching.